The world is facing a concerning rise in obesity. This alarming trend is not confined to any one region or demographic. It is a global issue affecting millions of people across various age groups and socioeconomic backgrounds. This isn't just a cosmetic issue. The impact of obesity goes far beyond appearance, affecting mental health and self-esteem, and leading to a host of physical health problems. Obesity significantly increases the risk of serious health problems like heart disease, stroke, type 2 diabetes, and some cancers. These conditions can drastically reduce quality of life and lead to premature death. Australia in particular has witnessed a dramatic surge in obesity rates, now ranking among the highest globally. This rise is attributed to a combination of factors including sedentary lifestyles, poor dietary habits, and genetic predispositions. Our healthcare system is feeling the strain. Hospitals and clinics are overwhelmed with patients suffering from obesity-related conditions, leading to longer wait times and reduced quality of care. The cost of treating obesity-related conditions is skyrocketing. This financial burden is not only felt by individuals, but also by healthcare systems and governments, straining public health resources. Type 2 diabetes, often linked to obesity, is a major concern. Managing this chronic condition requires constant monitoring and medication, which can be both physically and financially draining for patients. This chronic condition requires ongoing management and can lead to severe complications. These complications include nerve damage, kidney failure, and even amputations, significantly impacting the lives of those affected. Addressing obesity is crucial for improving public health and reducing the strain on healthcare resources. Public health campaigns, community exercise programs, and nutritional education are essential steps in combating this epidemic. Clearly, we need to understand the factors driving this epidemic and explore effective strategies for prevention and management. By addressing the root causes and promoting healthier lifestyles, we can work towards a future where obesity is no longer a global crisis. Body mass index, or BMI, is a commonly used measure for determining weight status. It's a simple calculation that uses a person's height and weight to categorize them into different weight categories, such as underweight, normal weight, overweight, and obese. It's calculated by dividing weight in kilograms by height in meters squared. This formula provides a numerical value that can be used to assess whether an individual is within a healthy weight range. While BMI provides a general indication, it's not a perfect measure. It doesn't account for various factors such as muscle mass, bone density, and overall body composition, which can vary significantly among individuals. BMI doesn't differentiate between muscle mass and fat mass. For instance, athletes with high muscle mass may have a high BMI but low body fat, while someone with low muscle mass and high body fat might have a normal BMI. Waist circumference is another important indicator. It helps to measure the amount of fat stored around the abdomen, which is a critical factor in assessing health risks. It reflects the amount of fat stored around the abdomen, often referred to as visceral fat. Visceral fat is particularly concerning because it surrounds vital organs and is linked to various health issues. A high waist circumference is associated with increased health risks, even in individuals with a normal BMI. This includes risks for conditions such as heart disease, type 2 diabetes, and metabolic syndrome. Waist-to-hip ratio and waist-to-height ratio are additional measures that provide insights into body fat distribution. These ratios can offer a more comprehensive understanding of an individual's health status. It's important to note that ethnic differences exist in body composition and fat distribution. Different populations may have varying health risks associated with the same BMI or waist measurements. Therefore, BMI and other measures should be interpreted with caution, considering individual factors and ethnic background. Personalized health assessments are crucial for accurate health evaluations and effective interventions. Not all fat is created equal. Our bodies store fat in different locations, each with varying health implications. Subcutaneous fat, found just beneath the skin, is considered less metabolically harmful. Visceral fat, on the other hand, surrounds vital organs in the abdominal cavity and is strongly linked to metabolic disturbances. Ectopic fat, stored in the liver, pancreas, and muscles, further disrupts metabolic processes. Excessive visceral and ectopic fat contribute to insulin resistance, inflammation, and an increased risk of chronic diseases. Understanding these different types of fat is crucial for appreciating the health risks associated with obesity. Targeting visceral fat reduction should be a primary focus in obesity management due to its significant impact on metabolic health. Adipose tissue, once thought of as merely a storage depot for excess energy, is now recognized as a complex and dynamic endocrine organ. This tissue is not just a passive storage site, but actively participates in the regulation of various physiological processes. It secretes a variety of hormones and cytokines that have far-reaching effects on metabolism, appetite regulation, and inflammation. These secretions play crucial roles in maintaining energy balance and overall health. Among these hormones, leptin is one of the most well-known. Produced by fat cells, leptin communicates with the brain to signal satiety, helping to regulate food intake and body weight. Leptin, a hormone produced by fat cells, plays a critical role in energy homeostasis by signaling satiety to the brain, thus helping to prevent overeating. However, in the context of obesity, a condition known as leptin resistance can develop. This means that despite high levels of leptin, the brain does not receive the satiety signal effectively. This leptin resistance can lead to a vicious cycle of overeating and further weight gain, exacerbating the problem of obesity. As weight continues to increase, the risk of developing other metabolic disorders also rises, creating a complex health challenge. Adiponectin, another hormone secreted by adipose tissue, has beneficial effects on insulin sensitivity and anti-inflammatory properties. It helps to regulate glucose levels and fatty acid breakdown. Higher levels of adiponectin are associated with improved insulin sensitivity, which is crucial for preventing type 2 diabetes and other metabolic diseases. Unfortunately, obesity is often associated with lower levels of adiponectin, contributing to insulin resistance and chronic inflammation, which are key factors in metabolic dysfunction. Tumor necrosis factor alpha, or TNF-alpha, is another molecule secreted by adipose tissue. It is a pro-inflammatory cytokine that can contribute to systemic inflammation. Similarly, plasminogen activator inhibitor 1, or PAI1, is elevated in obesity and is linked to increased inflammation and a higher risk of cardiovascular disease. These inflammatory markers not only promote inflammation, but also increase the risk of developing cardiovascular diseases, which are prevalent in individuals with obesity. Understanding the intricate hormonal interplay within adipose tissue is essential for developing effective treatments for obesity and its related metabolic disturbances. This knowledge provides valuable insights into the complex metabolic disturbances associated with obesity, paving the way for innovative therapeutic strategies to combat this global health issue. Obesity disrupts the delicate balance of lipid and glucose metabolism, leading to a cascade of metabolic abnormalities. Insulin resistance, a hallmark of metabolic syndrome, impairs the body's ability to effectively use glucose for energy. This results in elevated blood sugar levels, increasing the risk of type 2 diabetes. Obesity also disrupts lipid metabolism, leading to dyslipidemia, a condition characterized by high triglycerides, low HDL cholesterol, and increased small dense LDL cholesterol. Dyslipidemia significantly elevates the risk of cardiovascular events. Non-alcoholic fatty liver disease, or NAFLD, another consequence of metabolic disruption, is becoming increasingly prevalent, even in children. Addressing these metabolic disturbances is crucial for mitigating the long-term health consequences of obesity.